Hello everyone, our today's topic is syphilis. Syphilis is caused by Treponema palladium. Remember, it is a spiral shaped bacterium. It resembles a spiral shaped in appearance. It is a coiled spiral filament about 10 micrometer long and it can move actively. Now, how can you detect this bacteria? You can detect these bacteria through various like the dark ground illumination, fluorescent antibody technique, silver impregnation method, PCR technique. So these are the various methods that you can detect the Treponema palladium bacteria. So the dark ground illumination technique, it uses a type of light microscopy where light is directed at angle that causes the spirochete bacteria. In the dark ground illumination, it consists of special light microscopy where the light is directed at an angle and it causes the spirochete to appear bright against a dark background. Other is fluorescent antibody technique. It involves antibodies labeled with fluorescent dye that specifically bound to the Treponema palladium antigen, and when exposed to UV light, they fluoresce, making them visible under the fluorescent microscope. The other is the silver impregnation method. So this technique stains the bacteria with silver compound, that making them visible under the microscope. PCR, it is a molecular technique that amplifies the specific DNA sequence of the Treponema palladium, allowing for the detection of the genetic material. Now, what are the techniques that we can use to demonstrate demonstrate the Treponema palladium? The answer is we can use dark stain illumination, fluorescent antibody technique, silver impregnation method, and the PCR method. Now remember, the Treponema, it does not produce endotoxin or exotoxin. So the lesions in the syphilis, they are primarily due to the host immune response. So there are two types of serological tests for the syphilis. One is the treponemal test and other are the non-treponemal test. The treponemal test they measure the antibody specific to Treponema palladium species. So they could be fluorescent Treponema antibody adsorb test, FTABS test. Other could be microhemagglutination assay for Treponema palladium, MHA-TP test, or TPHA test, Treponema palladium passive hemagglutination test. Whereas the non-treponemal test, they measure non-specific reagenic agents, again cardiolipin, lecithin, cholesterol complex. So remember, the non-treponemal tests, they are the blood tests that are used to screen for syphilis by detecting the non-specific antibodies that the body produces in response to cellular damage that are caused by the Treponema palladium species. So they do not detect antibodies specifically against the treponemium palladium itself. Instead, they detect antibodies against the cardiolipin lecithin that is released from the damaged cells. So most common test that we use is VDRL test. So it uses an antigen that is composed of cardiolipin, cholesterol and lecithin. The patient's serum it is mixed with antigen and flocculation. Clumping is observed if antibodies they are present. Other test we can use is RPR test, that is a rapid plasma reagent test. It includes carbon particles to make the reaction visible without a microscope, and it can be performed quickly and it does not require a microscope. So the advantages of non-treponemal tests, they are inexpensive, easy to perform, give a quick result, they are useful for initial screening. The disadvantages could be they can produce false positive results due to other conditions like that causes cellular damage such as autoimmune diseases, pregnancy and certain infections. Remember that the VDRL test, it's easy to perform, gives quick results, but it has lower specificity and sensitivity compared to the treponemal test, whereas FTA-ABS test, it is highly specific and sensitivity and it is used for confirmatory diagnosis, but it is costly. TPAH, they are highly reliable test and they are suitable for the large scale applications. Now let us discuss the mode of transmission of syphilis. Syphilis, it can be transmitted through various routes. One are the sexual intercourse route that could lead to lesion on the genitals. All intimate person to person contact leading to the lesion on the lips, tongues and finger. Or it could be due to the blood transfusion route, or it could be the materno-fetal transmission as seen in case of congenital syphilis. So what are the possible modes of transmission for syphilis? It is through the sexual course, intimate course, blood transfusion or the maternal transmission. Now let us move to the stages of the syphilis. The syphilis progress through four main stages. They are the first is primary syphilis, secondary syphilis, latent syphilis and tertiary syphilis. So let us start with the primary stage. So in primary syphilis, the most important feature that you will see is a chancre. So who can describe what a chancre is? So chancre, remember, it's a firm, painless, non-itchy skin ulceration that appears at the site of infection site. Usually it is of 1 to 2 centimeter in diameter, and it generally shows up about 2 to 6 weeks. And this ulcer, it can occur on genitals, rectum or the mouth. So the primary lesion is a chancre which appears 2 to 4 weeks after the exposure. So this chancre, remember, it's painless papules that ulcerate in the center. So this chancre, it heals without scarring and even without treatment. So on histologically, you will see dense infiltrate of the plasma, lymphocytes and macrophages. There would be aggregation of mononuclear cells, proliferation of the vascular endothelium. So what is the characteristic lesion of the primary syphilis? It's the chancre. Now moving on to the secondary syphilis. So that occurs about the secondary syphilis. It occurs about around 4 to 8 weeks after the appearance of the primary chancre. So here you would see a wide spread rash. So here you will see a widespread rash that is often seen on the palms of hand and soles of feet. So what other symptoms do you think might appear in this stage? Other symptoms include fever, there could be sore throat, swollen lymph nodes, and mucus patches. So mucus patches, it can appear on the mouth, pharynx and vagina. So the most common feature there that you would see in secondary syphilis is condyloma lata, that is seen in anogenital region, and apart from that generalized skin eruptions could be seen. So what are the common features of secondary syphilis? The mucocutaneous lesions, lymphadenopathy, and the generalized skin eruptions that could be seen. The third stage is the latent syphilis. So the latent syphilis, it can last for years, and it can be divided into early or the late latent stage. So during the early latent phase, the infection can still be transmitted, while in the late latent stage, it is less likely to be infectious. So what do you think? What happens if the syphilis is not treated during this stage? If it is not treated, it can progress to the tertiary syphilis. So the tertiary syphilis, it appears after a latent period of secondary lesion about 2 to 3 years of 1 to 10 or 2 to 10 years of age after the infection. So lesions here are less infectious as compared to primary and secondary syphilis. Spirochetes, they are difficult to demonstrate in the tertiary syphilis. So when do tertiary syphilis lesion typically appear? Remember, they appear around 2 to 10 years after the initial exposure. So here the most important feature that you would see is gamma formation. So what are gamma? So remember, gamma, they are soft, non-cancerous growth that results from the tertiary stage of syphilis. So what are they? They are typically soft, rubbery and granulomatous. That is, they are composed of granulomatous tissue. So they can develop in any organ or tissue, but they are most commonly found in skin, bones, liver, and the nerve. The gammas, they grow slowly and they can be painless or painful depending upon the location and the size. So gamma, they are thought to be result from an immune response due to persistent presence of Treponema pallidum bacteria in the body. The body forms granuloma, that are the clusters of immune cells. So that lead to formation of the gammas. So symptoms, they will appear as nodules or ulcers, then can eventually become necrotic. That could be Skin gammas, bone gammas, they can cause pain and fractures, and organ gammas, they can affect various organs like the liver. They can cause gammas in the brain. Neurological gammas can cause the neurological symptoms. Remember, in the liver, these gammas, they can lead to scarring of hepatic parenchyma. That is a condition, we call it heparlobatum. Now the histology of gamma, the frontal area, it shows the coagulative necrosis. And there is central necrosis, and the surrounding zone, it contains macrophages, many plasma cells, lymphocytes, giant cells, etc. So where can gamma be found in the body? It can found in the organs like the liver, testes, bones, and the brain. Now the tertiary syphilis, it can affect the heart or the brain. It can be neurosyphilis or the cardiosyphilis. So in the cardiovascular syphilis, you will see is the aortic aneurysm, incompetency of the aortic valve, narrowing of the coronary ostia, whereas the neurosyphilis, it can affect the meninges, tapes dorsalis, that affect the spinal cord, and it can affect the brain. Now let us discuss some important MCQ point, and let us have a quick wrap up and a quick quiz. A painless ulcer on the genitals. So which type is it? Yes, it's a primary stage. Second is a widespread rash on the palms and sole. The answer is, it's which stage? It's secondary stage. No symptoms but a positive blood test for syphilis. The answer is latent stage. Other is soft non-cancerous growth and neurological problems. Years after the initial infection, it's which stage? It's the tertiary stage. So fantastic job. Now another syphilis is congenital syphilis. It occurs when the fetus is exposed to maternal spirochete after 16 weeks of gestation. So what are the major symptoms that you would see here? Is the Hutchinson triad. What is that? It involves ears, eyes, and teeth. So there is eighth nerve deafness, interstitial keratosis involving the eyes, and mulberry molars that are seen in the teeth. Or you can see is the Hutchinson teeth. So these are the Hutchinson teeth. The small widely peg-shaped permanent teeth. Apart from that, you could see the saddle nose. Saddle shaped nose due to the destruction of the bridge of the nose, that is the major feature of the congenital syphilis. Mucocutaneous lesions that could be seen, bony lesions, interstitial keratosis that lead to corneal opacity. There could be diffuse fibrosis in the liver that affect the liver function. So what are some characteristic feature of the congenital syphilis? That includes the saddle-shaped nose, Hutchinson teeth, mucocutaneous lesions, bony lesions, interstitial keratosis, and fibrosis in the liver and the lung.